Hi, Dr. Pelto here. I'm going to give you these are some tips I give to my residents about surgery when you're first starting out. The first thing that you're going to find in this section is going to be something I call a pre-surgical discussion. Basically a PowerPoint that you can go that's going to go over some of the typical questions that you should be asking your patients that I ask my patients, some of the typical complications that you're going to review. And this is done prior to doing the consent in the office. So this is done usually within 30 days of the surgery. I'm also including another document that's going to be kind of what I call my surgical template. Basically, these are the sapahemi of your procedure, of what type of materials that you need. For some of the more common procedures that I do, you may want to add to this, and it has little notes and reminders that I put on this document. So that's the second thing that I'm including here. These are the kind of the pre-surgical things. And the third thing I'm putting on here is something called it's an evaluation form that I use before surgery. So I kind of look at, well, what's what I'm wanting to do, what's the best that could happen, worst that could happen, and my plan for surgery. And then when I finish, then I kind of look at, well, what went well, what didn't go well, what would I do different? And this is something I think is real important as you're starting surgery, to plan your surgeries out, write out kind of what your plans are, get everything prepared, and then evaluate when you're completed. And this is something that I teach my residents as well how to do. So I hope you find these surgical tips helpful for you. And I'll add other things on throughout the years if there's other areas that are of interest or that are of concern. Okay, thanks.